perspective. A closer look at the week's top stories and the stories you may have missed. I'm Sherry Preston. Coming up, a retelling of the Central Park Five. But first, Dr. Mike Magee is a medical historian and journalist on the faculty of President's College at the University of Hartford. For 8 years, he also served as head of global medical affairs for Pfizer, working as the physician spokesman for that company's most notorious product, Viagra. Dr. Magee has written a new book called Code Blue, Inside America's Medical Industrial Complex. I got a chance to talk with him recently about the premise of his book, that the American healthcare system is broken. Let's talk about the new book that you've written called Code Blue, Inside America's Medical Industrial Complex. Really fascinating how you talk about the pillars of the health system, which include big pharma, insurance companies, hospitals, and you also say the American Medical Association. Why that fourth one, the American Medical Association?
Well, since the beginning, the AMA has had a relationship with industry. Even before there was a health insurance industry, the AMA was interacting with the pharmaceutical companies in a variety of ways. Mostly at the turn of the century, it was through journal advertising. But beginning right after World War II, there was a relationship that became thicker than that. Arthur Sackler, who is notorious now for having been the father of OxyContin and the man-made opioid epidemic, actually got his start as a marketer within the medical industrial complex. His first major client was Pfizer in 1950, and he was the one who invented the detail man that came into doctors' offices, as well as advertisements on television. His first one was in 1957. We're one of only 2 countries in the world that allows for direct-to-consumer advertising. So the AMA has had a long relationship with the pharmaceutical industry and also with health insurers, and many times their needs and their priorities have aligned quite well.
So tell us more about your premise that America's medical system is simply, it's broken.
Well, to tell you the truth, as a medical historian, I always wondered why we were such an outlier. I mean, we pay twice as much as any other country in the world, and we get results that, on the whole, are pretty dismal. Our mothers who are giving childbirth are 3 times as likely to die in childbirth as other nations. Our children before the age of 5 are twice as likely to die unneeded. We have 4 times the number of lobbyists in healthcare in Washington, D.C., as there are lobbyists for the military-industrial complex that Eisenhower warned us about. So I wondered, why were we such an outlier? And I spent about 10 years connecting the dots, and what it turns out to be is that beginning right after World War II, we took the course that was quite different than all other nations. Other nations struggling with soldiers coming home and having all sorts of psychiatric illnesses and addicted to tobacco and alcohol, or having traumatic injuries from the war itself. They asked themselves, as a national imperative, they asked themselves, how are we going to make our citizens healthy? How can we be a healthy, productive nation? In America, we never asked that question. What we said instead was, look, if we could defeat disease the way we just defeated the Nazis, health would be left in its wake. All we need to do is cure diseases. So in choosing cures over care, we decided to allow profiteers to have at it. And they basically have worked to find cures for everything. And what has happened in the process is we've become sicker and poorer over a half a century because we never really had a plan for taking care of all of the citizens in our nation. People are being surprised by bills all the time. Almost 20% of the American public is now at risk of bankruptcy because of medical bills that they didn't expect to get.
Wasn't Obamacare supposed to solve all of this? But really all it did was help big insurance companies and big pharmaceutical companies. And Are we worse off now than we were before?
No, I don't think we are. Clearly Obamacare has not fixed all the problems, but let's consider what it did do. First of all, it started a national debate that has led to now overwhelming numbers of Americans saying, yes, universal health care should be a right. It shouldn't be a privilege just for the wealthy or the lucky in this country. The second thing it did is it brought up this issue of what an adequate benefit package is and how we must protect the most vulnerable. You can't be denying people with pre-existing conditions the care that they need. So that was very important that people be aware that the benefit package has to be consistent across the country. The third thing it did was at least it got the insurance company, the AMA, and the pharmaceutical industry to the table. Now, Obama gave quite a lot back to those sectors in order to get them to endorse some change. And we're still trying to figure out how to straighten out some of those things. For example, why do our pharmaceuticals cost twice as much as everybody else?
Okay, so to fix America's healthcare system now, what is the number one thing that could happen?
That we have universal coverage. Universal coverage with good, stable, predictable insurance, national standards. We need to finally go back to where we should have been in World War II and ask this simple question. How do we make America and Americans healthy? And the answer we'll find is going to be in good, solid, standardized healthcare coverage, a good national plan for making Americans healthy, and also we need predictable costs.
Okay, Dr. Mike Magee, author of Code Blue, Inside America's Medical Industrial Complex. There's a lot more in there about the opioid crisis and many more things when it comes to our healthcare system in the U.S. Dr. Magee, thank you so much.
Thank you, Sherry.
Coming up.